Hello, my friend. Welcome back to the Holistically Well podcast. Today, we're diving into one of the most common questions that I have been getting asked recently, which is, can I exercise in the first trimester of pregnancy? The short answer, yes, and you absolutely should. However, it gets a little bit more nuanced than that, and we are going to break it down today. So it matters how you move because the first trimester isn't just about staying active. It's about laying the foundation for core and pelvic floor health that supports you throughout pregnancy and into postpartum recovery. So, whether you're newly pregnant, trying to conceive, or supporting a friend going through this life season, this episode will equip you with science backed, whole body, pelvic floor aware exercise tips for the first trimester of pregnancy. Now, why does exercise look different in the first trimester? Let's start by zooming out. Now, even though you may not look pregnant yet, your body begins changing and undergoing massive shifts as soon as you conceive. Now, that starts at about week 4 of where your pregnancy timeline begins, right? And immediately our hormones are shifting. Posturally, things are shifting internally, and neurologically, our system is shifting. So, let's talk about the hormonal shifts. You have a hormone called relaxin that starts increasing within your body. And this does affect our joint stability. It actually relaxes our ligaments, and we have tons of ligaments around your pelvis specifically that create a lot of stability there for us typically. Now, when that hormone relaxin starts increasing, it does affect the stability of our pelvis. And this is why hip pain, glute pain, sciatica, back pain is all so common in pregnancy. This can be a key part of it. Now, fatigue and nausea, these are common symptoms that can disrupt your usual workout rhythm. So if you haven't grabbed my free guide to support this, please do. If you DM me first try on Instagram, I will send it to you. We specifically address fatigue and nausea and ways that you can help your body combat that during this first trimester because it absolutely can affect your ability to work out. And then the other big shift that starts happening right away is that your core strategy begins to change. Your deep core muscles, which would be your transverse abdominis in the front wall that wraps around to your backside, and then your pelvic floor on the bottom, they start to respond differently even in early pregnancy because of all the changes going on beneath the surface. So, if you're still pushing through high intensity workouts that you had been doing pre pregnancy without any modifications, your body may start to compensate in ways that lead to increased separation of the abdominal muscles, known as diastasis recti. You might impact pelvic floor dysfunction and increased pressure or discomfort, especially in that pelvic floor area. Now, these may not be symptoms that you notice right away, but if we don't begin to have more intentional awareness surrounding exercise already in this first trimester of pregnancy, you can lead to increased issues down the road. And that's why this is so important. Now, another concern with high intensity exercise, particularly during the first trimester of pregnancy, is the potential increased risk of loss. Now, if we think about this from a nervous system and a biological standpoint, it makes sense that our body wants to feel that it is a safe time to carry new life. Now, if you are working out at a high intensity, so let's say 80% or greater of your maximal exertion effort, and you are doing this multiple days a week, this begins to take its toll on your nervous system. So, I do not recommend high intensity exercise during the first trimester of pregnancy, especially. Now, I am an exercise physiologist. I am a doctor of physical therapy. I have over 7 years of collegiate education studying exercise's impact on human physiology. I am a huge proponent for exercise. I literally spend my career prescribing exercise. So I want you to exercise in pregnancy, and we are going to break down exactly how. There has been so much conversation in recent years about the benefits of exercise during pregnancy, and I think that is fantastic. Now, the missing link with this, though, as we've shifted from this protective space of women in the first trimester of pregnancy and throughout their entire pregnancy, and not wanting them to do very much, to shifting to this empowerment side of things where women can exercise during pregnancy and they should exercise, and these are all the benefits. What's gotten missed in this shift is the how to do it safely, because women just keep doing what they were doing. Sometimes that's fine if you were doing a lot of Pilates or different moderate intensity exercises. That can be great to continue what you already were doing. But if you were somebody who was doing high intensity interval training workouts and sprint workouts and training for marathons, that may be too much for your system during pregnancy. And so we do need to shift the focus. So that's what we're going to break down today. I want you to have the how to continue to exercise safely during pregnancy and not just this left in between and not knowing where to go. So to support the benefits of exercise during pregnancy, I do want to acknowledge a systematic review and meta-analysis. These are high-quality research studies that found no significant association between exercise practice during pregnancy, looking specifically at low and moderate intensity exercise and miscarriage risk. So it is absolutely safe and necessary to exercise during pregnancy. We just want to be mindful of the intensity, as there is research that has supported the fact that high intensity exercise can lead to potential increase in risk of pregnancy loss. Now, this is why the first trimester is a time to shift from more performance-driven workouts to function-focused movements. So let's discuss the specific benefits of exercise in pregnancy. Studies show that prenatal physical activity and exercise can reduce the risk of major pregnancy complications, such as gestational diabetes, preeclampsia, and gestational hypertension, according to the University of Alberta. Exercise may help to normalize blood pressure levels and improve cardiovascular conditioning in pregnant women. Exercise in pregnancy also has blood flow benefits to baby, which improves infant weight at time of birth. And exercise during pregnancy has shown to reduce the duration of the pushing phase of labor. So if you need some good whys as to why movement is extra important, there are some good full body benefits for both you and your infant. Now, key goals for first trimester movement, here is what we are aiming for. So I have 3 important aspects that we are aiming for. Number 1, we want to preserve your core and pelvic floor coordination. Think of your core as a pressure system. It's not just your abdominals. We have your front core wall. We wrap around the side, the back, your pelvic floor, which is the bottom of that core cylinder, and then your diaphragm sits as the top. This all needs to function as a pressure management system to help avoid prolapse, leakage, incontinence, and pain in general in any of those areas. So deep breathing, gentle core activations, and postural awareness are key for really laying the foundations of your core and your pelvic floor coordination. Now, the reason this is extra important the first trimester is we haven't had a huge shift in the expansion of the abdomen yet. You'll start to notice that later in the first trimester where you'll start to feel that expansion. But we want to begin this coordination early on before the mechanics of it all has changed. When women wait to come to me until their 3rd trimester of pregnancy, it is that much harder to connect with the pelvic floor and the deep core because of the expansive shift that has already happened. If we can start connecting with these areas now, as soon as you get that positive pregnancy test, or my goodness, even beforehand, while you are trying to conceive, then it makes it that much easier to maintain good pelvic floor and core strength and stability throughout the duration of your pregnancy, helping you avoid pain, avoid prolapse, avoid leakage, and then leads to increased ease of recovery postpartum. Now, the second key factor here is that we want to promote blood flow circulation and lymphatic flow. So this helps with a natural, healthy detox. I'm not talking like a specific detox plan because we do not want to do that during pregnancy and lead to any detox factors in your blood to baby. But I'm talking with just gentle, normal detox methods. When we exercise, we sweat out toxins. We're increasing lymphatic flow. That also helps remove waste from our body. This can help with digestion. So constipation can absolutely be an issue during pregnancy. And by moving the body, we are assisting our ability to digest food and move it through our system. And then exercise can actually help you feel better. It can help you reduce that feeling of fatigue. So particularly in this first trimester when fatigue can be rampant, energy levels can be low, if we can start programming in movement that actually leads you feeling more energized afterwards, that is the goal. And that is the type of exercise programming I have within my Holistically Well pregnancy program so that you finish feeling more energized and not more exhausted. That's when you know you are at the sweet spot in terms of exercise intensity. So even if you are feeling like very low energy levels, I do encourage you to try some gentle movement and actually see how your body responds. You might be surprised. So in terms of promoting circulation and lymphatic flow, low impact movement can absolutely be great here. Things like walking, mobility circuits, or resistance training are all great ways to promote this in your body. And then third and final key point that we're aiming here for movement in the first trimester would be to support your emotional health. Exercise improves our energy, it reduces stress, and gives you a sense of control in a season where so much is changing. Many women that I talk to see exercise as an outlet, a stress relief. And sometimes that is running, sometimes it is a hot yoga class or a heated Pilates type class, and I think that's fantastic. But if we can shift some of those workouts to where we're still getting that emotional release without too much physical strain, that is the sweet spot we want to be in. So if your current stress reliever is going out on a high intensity run, what if we go out on a run that's more moderate intensity? So instead of running 6 miles at your race pace, you run 4 miles at a pace where you can hold a conversation with a running partner. If you have always loved a heated yoga or Pilates class, let's take a non-heated yoga and Pilates class. You're still going to get that stress relief, the strength building aspect, and that emotional health support, but without increased risk to you or to baby with that heat. Now, let's discuss physical therapist recommended movement types. So I am a doctor of physical therapy. I am a board certified orthopedic clinical specialist and hold additional certifications in women's health and pelvic floor physical therapy. And when I am looking at exercise programming, specifically in the first trimester of pregnancy, first and foremost, I am looking at the breath. If somebody's breath is all in the upper chest, you are not at all connecting with those deep core and pelvic floor muscles. It's also increasing your stress response when you are only breathing into the upper chest and not getting movement into your diaphragm, which connects with your vagus nerve. So starting point number 1 is diaphragmatic breathing. This is foundational for your core and your pelvic floor health. I recommend just laying on your back, putting one hand on your chest, one hand on your belly, letting your eyes gently fall closed, and breathe. You're going to inhale for 4 to 6 seconds and exhale for double that. So you're looking at an 8 to 12 second exhale. And you want to pay attention to which hand moves first. It should be your bottom hand. We want good expansion in our core and to actually feel movement down into that pelvic floor as well. We cannot strengthen a muscle that is too tight. So getting this expansion first is absolutely key, because if you're breathing only into your upper chest and you're getting no movement down into that core and into that pelvic floor, those muscles aren't having the ability to expand and lengthen and then having the ability to contract through their full range. So first, you're focusing on the expansion, and then on your exhale, I want you to blow out through pursed lips as though you're blowing out a candle or as though you're blowing blowing out through a straw. And on your exhale, envision lifting that pelvic floor first. You can think about lifting a marble through your vaginal opening to initiate that lift of your exhale. As you keep blowing out, feel a gentle tightening of that deep core. Now you can find your transverse abdominis, your deep core muscle, by placing 2 fingertips just inside your pelvis, or what a lot of people think of as their hip bones. So just inside your pelvis. And as you blow out, you'll feel gentle tension underneath those fingertips. That is your deep core. That is your transverse abdominis. So once you've established that foundational connection, then we can begin to load the core in various positions, like bird dog on your hands and knees, or a bear crawl position on all fours, or lying on your back, doing a dead bug exercise. So all of these ways that we can program in core bracing, but it all starts with your breath. Next, we're looking at pelvic floor support. So this goes so far beyond Kegels. I never use the word Kegels in my office in terms of exercise prescription. I simply do not, especially during pregnancy, because what we want for the pelvic floor muscles during pregnancy is the ability to adapt and change. And if we are only focusing on Kegels, you're only focusing on the shortening portion of that contraction. Now, if we think about what needs to happen in childbirth, it is not shortening of those muscles. It is expansion, it is relaxation, and it is letting go. So again, already in this first trimester, we want to look at coordinated movement here. So that goes back to the breath, where you're getting inhale, length into that pelvic floor, and then on your exhale, you're getting that gentle contraction. And what you can begin to start practicing is this contraction in accordance with what you are doing. So for example, you're practicing some core movement at rest, you're laying on the mat. It's going to be a very gentle pelvic floor contraction because it's not under load. Now, let's say you have always done resistance training, you enjoy squatting with dumbbells in each hand or with a bar on your back. I'm good with you continuing that as long as you can pair it with your breath. So now that pelvic floor is under more intense load. So we want to inhale down in terms of a squat motion, and then on your exhale, you want to gently engage that pelvic floor. So again, think about closing that vaginal opening around a marble, and as you exhale, pull that marble up and in. This is going to brace your pelvic floor. On the exhale, you'll keep blowing that air out as you rise to stand, lifting that load. That pelvic floor contraction is going to need to be much greater than, for instance, your core work on the mat. So starting to pair your pelvic floor activation in accordance with the load that you are lifting, that will help support your pelvic floor and help you avoid things like prolapse and leakage. If at any point you start noticing pressure down in that pelvic floor when you're doing that typical squat motion that has always felt good, or you notice a little leak of pee as you exhale on that effort and rise to stand with your loaded squat, that would be your key indicator that it's time to offload some of that weight. Now, other examples of incorporating the pelvic floor with movement would be bridge paired with your breath. So you're going to bridge up on the exhale with effort there, and you'll inhale down. Cat-cow is a great mobility exercise on your hands and your knees, where you inhale and extend through the spine, and then exhale, gently wrap pelvic floor around through the spine and feel that deep core pull up and in. So you'll notice that the pelvic floor and the core very much work in unison with one another and very much in unison with the breath. Next, whole body strength and mobility. Here we want to stick with more that low to moderate intensity resistance. We don't want to be necessarily maxing out our lifts here. That could lead to something like the Valsalva maneuver, which is where you are holding your breath in order to optimally brace the core to take on such a huge amount of load. We want to be sticking with resistances that we can breathe through. So we want to inhale on the eccentric portion of the movement. So for instance, a squat, it would be the lowering portion of the movement, and then you want to exhale on the concentric portion. So that would be when the muscles are shortening, we're going to engage and lift. Another example would be biceps curls. So we want to inhale on the lowering of our arm, and we want to exhale on the concentric portion that engage and lift. Rows would be another example. Inhale as you lower the weights down, exhale, engage and lift, row the arms back. So any exercise can be paired with our breath, and that is so important during pregnancy in particular because it helps us avoid too much pressure down on that pelvic floor, and it gives us the opportunity to strengthen and coordinate that pelvic floor and that deep core no matter what area of the body we are strengthening. So for whole body strength and mobility, a few favorites would be things that I already mentioned. We went over the bridges, the squats. Those are double leg movements, which in terms of that hormone relaxin is just going to help create a lot of good stability to the pelvis. Now, I love programming in single leg or split stance movements still during pregnancy. If you have, though, SI joint pain or pubic symphysis pain, any kind of single leg or split stance movement is not going to feel great for you. So you'll want to stick with more double leg movements. However, particularly in the first trimester where we don't have as high of a degree of relaxin and again, not as much change in terms of baby's load on our body, absolutely, I want you to still program in single leg and split stance work because we don't want to lose that, right? So this could look like single leg RDLs. It could look like reverse lunges, lateral lunges, single leg squats, step ups, and really focusing on your form. So again, pairing the movement with your breath. And then also, if you have a mirror available, looking at your pelvis as you move. We want that pelvis to stay nice and level. If looking in the mirror, your pelvis drops, so the leg that's lifted, let's say you're doing a single leg squat, the leg that is not on the ground, that pelvis is lower to the ground than the leg you're standing on. It means the leg you're standing on is not optimally supporting your pelvis to maintain balance. So if you have access to a mirror, that is very beneficial with any single leg work to make sure your form is looking correct. And then if at any point you're unable to maintain that steady pelvis, that level pelvis, you can drop it to an 80-20 squat where one foot's down to kind of offload the weight and help with that symmetry. As that gets too hard, then you can shift to double leg. So just some things to process through, and this will be different for everybody in terms of what your whole body strength and mobility routine looks like, if you're adding resistance or not. So much of that does depend on what you were doing prior to pregnancy. If what you were doing prior to pregnancy still feels good from a resistance standpoint, you can maintain that resistance. But as load of baby increases or as your ability to manage that pressure system changes, then you will have to offload that weight. Now, fourth and final, in terms of PT recommended movement types during the first trimester of pregnancy specifically, would be walking, rebounding, or gentle cardio. So 20 to 30 minutes walking is just pure gold. There are pretty much zero risks involved with that and so many benefits. This is especially great if you can do it after a meal. So after dinner, getting out on a 20 to 30 minute walk will help you with blood sugar regulation and get that lymphatic flow. So in terms of helping with that waste removal from the body. Walking is great to continue throughout the duration of pregnancy. As you get closer to that third trimester, it's going to help baby gently rock into his or her optimal positioning. So just keeping up with that walking now can be absolutely wonderful. Now, when it comes to cardio, this is a really good talking point because so many women have questions about running. If you were running prior to conception, you can absolutely continue running during pregnancy. Again, we want to just look at intensity here. So if you were, let's say, training for a marathon and this is your first marathon, you've done halves in the past, but this is your first full, I would encourage you to consider sticking with a half marathon, right? So sticking with what your body knows and at a level of intensity that is not leaving you feeling drained. If you go out on a run and you finish and you have to lay on the couch for 30 minutes afterwards because you are just so exhausted, that is too much. You should be able to finish your run feeling a little bit breathless, but you can start a conversation right up. You're getting yourself some water and electrolytes, and you're like, that felt so good. And you were able to complete that run without any leakage, any feelings of pressure in that pelvic floor, and without any back or hip pain. Those would be signs that that was an appropriate intensity for you at this point in pregnancy. So again, if we take this back to kind of that biological standpoint, we want the body to feel safe. If the body feels energized after a run and you feel this amount of stress relief and this emotional invigoration of like oxygen and good hormone release, then you can continue that. But if you feel absolutely exhausted and your nervous system is kind of getting this input that your body's in danger, that is where we get concerned in terms of how that may be affecting baby, right? So we're looking at this both from a nervous system standpoint and from a pelvic health standpoint. So this is something you're just going to have to continue to monitor as your body changes during pregnancy. Personally, as a mother of now 4, I have my 4th baby inside of me right now. I pull back in the first trimester. My last 2 pregnancies, I was okay with just doing more walk jogs and not feeling like, oh, I still have to run 3 to 6 miles every other day, as I had felt in my first trimester still of my first pregnancy. I continued to push myself. In this 3rd and 4th pregnancy, I have just been okay with pulling back because I know that my body feels better. I have less nausea, food aversions, less exhaustion whenever I stick with more of that low to moderate intensity exercise, particularly in this first trimester. I am not scared of running. I'm not fearful of running. I will still jog around the block with my kids. I will still chase after my kids in the yard. I still work it into my routine in a way that just feels good for my nervous system, but not in a way that leaves me feeling drained. So I hope that's helpful in terms of a cardio standpoint. But the same is true for things like swimming, cycling, elliptical. Do it in a way that feels good for your body right now and adjust as needed as you progress through pregnancy. So, what to modify or avoid to sum that portion up? These are common things that I encourage my patients and online clients that I work with to rethink. Again, that high intensity interval training, especially without any pelvic awareness or breath awareness or intensity awareness, that can be detrimental to the pelvic floor, the nervous system, and potentially that new life within you. And so just consider modifying that to a lesser intensity or choosing things that align with more that moderate intensity exercise planning like Pilates or resistance training. And then we do just want to be mindful of your core work. Now, again, during the first trimester, we probably should not be noticing things like coning. So I am absolutely good with you continuing your typical core routine, but go back to that section that I talked about your breath and how to integrate core work with your pelvic floor and your deep core, because that is absolutely integral. As you progress through pregnancy, you will want to watch for any coning of the abdominal muscles as you do core work, because that is a sign that your body is just not managing that pressure appropriately. And that's where we would maybe want to modify the intensity of that particular movement or focus more on that exhale and see if you are able to perform that movement without any coning. Something I absolutely want you to avoid is holding your breath. This would be the Valsalva maneuver. Again, very common in things like CrossFit or Olympic weightlifting, where you're focused on more that maximal lift effort. We want to avoid Valsalva. We want to avoid holding the breath. This increases pressure to the abdominal region and the pelvic floor, increases your risk of herniation in the abdominal muscles, increases risk of prolapse in the pelvic floor, which is literally your internal pelvic organs prolapsing through that vaginal wall, that perineal wall, and that heaviness feeling in that pelvic floor or that bladder region. This holding of the breath can also increase issues of leakage, and it can spike your blood pressure, which is not good for you or baby. So do not hold your breath with any lifting maneuvers, or when you're doing core work. I'll commonly see women hold their breath without even realizing it as they're doing bridges or as they're doing a plank. So make sure you are going back to that breath section where I taught you how to breathe appropriately and practice that. Now, any movement that causes pain, bulging, heaviness, or leakage, we too would want to avoid and modify. Focus on rebuilding up your strength so that you can tolerate, for instance, a single leg movement. But anytime you're getting that pain, bulging, heaviness, or leakage, you need to pull back from that. Now, a area to avoid or modify that I hear so commonly in group fitness classes that I actually am going to call out as a myth would be lying on your back to exercise during pregnancy after 10 to 12 weeks. This is a myth. You can lay on your back safely to do things like bridges, to do things like hook lying dead bugs during pregnancy for as long as you are able to without feeling dizzy or increased nausea. Okay. So this is going to vary for each woman. But the reason that we hear this is that there is a concern of reduced blood flow to baby because of pressure through that main artery that runs down the center of your abdomen. Now, this is a blanket statement from ACOG, which is the American College of Gynecologists, a blanket statement across the board that women after 10 to 12 weeks of pregnancy should avoid exercises lying on their back and avoid sleeping on their back. And a woman that is potentially obese with a great amount of adipose tissue in addition to her infant, that is going to affect that main artery different than somebody who is in a healthy weight range and has exercised prior to pregnancy with no blood flow concerns, right? So I encourage you when it comes to this to listen to your body specifically. I felt good in my third trimester of my third pregnancy, still doing exercises on my back. Now, what I would be mindful of is creating these in a circuit format where you're doing, let's say, a bridge on your back, and then you're laying on your side and doing a side lying leg lift, then rolling back onto your back, doing a core move on your back, and then rolling to the opposite side for that side's leg lift. So you're programming it in a circuit format that you're not spending prolonged periods of time on your back, but you absolutely can lay on your back for some exercise work. Again, as long as you're not getting any symptoms of like numbness, tingling, increased nausea, or dizziness. So to sum it up, we really want to focus on support and not stress on your body in early pregnancy movement because of both mama and baby. Now, I would like to dive into some personal examples for you because as both a mother and a physical therapist, now pregnant with my fourth child, I've seen a lot and I've been through a lot. And so, to be honest, during my first pregnancy, I thought I had to keep up with everything I was doing pre pregnancy. I was 26 years old when I conceived. I was extremely active. I was working in sports medicine at the time, 40 hours a week of patient care. I had just completed my 10th half marathon. I was a group fitness instructor. I taught Pilates and I would teach group fitness, but also do my own workouts. I would do 60-minute workouts, and I would get up really early in the morning to exercise prior to going into a full work shift. So, if we look at what that routine was like, it's very different than what I've been talking about thus far on this podcast episode in terms of what optimal exercise, particularly during the first trimester of pregnancy, looks like. And so I had intense nausea, I had vomiting, I had severe food aversions during that very first pregnancy. And quite honestly, I believe my body was screaming at me to slow down. It was screaming at me to sleep in, to rest more, to choose movements that were less draining to my body and instead really supported my body during that pregnancy. And so I share that example because oftentimes we don't know. And that too is why I brought up in the beginning the shift from us being very protective of pregnant women and telling them, don't lift that, don't exercise, being very cautious, to this shift to women can lift during pregnancy, women can run during pregnancy, women should continue exercising during pregnancy. And I was in that sports medicine world where we were so excited about this research that was pointing towards the benefits of exercise during pregnancy. And I was screaming that from the rooftops and doing it myself, where I kept exercising during pregnancy, but I was doing so at an intensity that was too much for my body during pregnancy. And I share that from a personal experience, but also in seeing it with so many patients, that when we pull back the intensity, where we're still prioritizing movement, but in a way that's more intentional, your full systemic response to pregnancy is likely going to be so much better, where you're not having as much nausea, you're not having that pure exhaustion, you're not having the food aversions because your body feels less stressed overall and more supported. So by the time I was pregnant with my third, I had totally shifted my approach and I felt so much better for it. I focused more on the breath work, the core awareness, the strength with intention, and gentle walks and some runs, but just at a lesser intensity. And it made a world of a difference how I felt both physically and emotionally. And that is why I created my Holistically Well pregnancy program, where I outline all of that. I outlined all of that with my third pregnancy. And now with my fourth, I'm seeing it hold true to fruition, which has been really incredible to see. Now, let's quickly recap today's episode. The first trimester is not about pushing through, it's about laying a strong foundation that will support you throughout the rest of your pregnancy and into postpartum. I want you to move in ways that support your core, your pelvic floor, your circulation, your lymphatic system, and your nervous system. We want to modify intentionally, not because you're fragile, but because you are being wise and you are laying the best foundation for both you and your baby. We always want to listen to your body and listen to its whispers before it needs to scream at you to slow down and listen to it. All right. So let's listen to those whispers, those symptoms, and what they are telling you now. So if you are looking for more guidance in your pregnancy, especially in your exercise programming this pregnancy, I lay all of this out for you inside my Holistically Well pregnancy program. This has trimester by trimester movement videos, core and pelvic floor strategies, and holistic wellness tips for each stage of pregnancy. All you have to do is press play, and I will move you through exercise routines. I will talk you through what to expect each stage of pregnancy and how to optimally prepare your body. Now, as a huge thank you for being part of this community, you can use the discount code THANKYOU100, the number 100 after the word thank you, as $100 off your pregnancy program. I have not yet done this on the episodes where I have offered a discount, and today I was just like, you know what? I want to send a huge thank you out to this community for being here. So if you grab the show notes, I will link the Holistically Well pregnancy program there. When you go to checkout, just drop in the code THANKYOU100. So that's thank you 100 for $100 off my Holistically Well pregnancy program. If this episode was helpful, could you take a second to just pause, go and leave a review? This will help spread the word to other women who are expecting and need the extra support that they just haven't found yet, right? So it truly means the world to me when you share this with a friend and when you leave your ratings and reviews. Thank you for being here. And until next time, let's be kind to your body and entrust its innate wisdom.